Hey guys, this is Abhishek. So welcome back. And the Neet PG 2025 results are out. And for some of you, it will be a day to reflect, to look back on how things could have been done differently. But for some of you, also it will be a day to rejoice as well. So to everyone who has put in a lot of hard work this past year, congratulations for the good ranks that you have got. And also there will be a category of people who will be confused as for what seat to choose, what would be the perfect branch for them. So here I am talking about my own branch, MD in Pediatrics. So let's just begin and let's just dive into the pros and cons of doing residency in pediatrics. So before we dive into the pros and cons, let's just burst a few myths right away. Is pediatrics dealing with miniature adults? No. Do they respond to the medication the same way adults do? Not really. And do they speak to you about their problems? Again, mostly no. And is a clinical examination in adults same as pediatrics? Again, no. So these are some of the few myths which I wanted to burst right away. And again, some things which you should ask yourself before you start thinking about pediatrics. Do kids induce stress or do they reduce stress? Okay, do you like being in the vicinity of children, and do you have a soft corner for them? Because these are some very pertinent questions, because if the answer to the above 3 or 4 questions is no, it's very highly likely that you might struggle in the residency and as a pediatric resident overall. Because for me personally, I think kids used to reduce stress, and I used to like being in the vicinity of kids. So in some way or another, if you're going to deal with kids, if you're planning to deal with kids throughout your life as a doctor, so you should have a soft corner for them, or maybe tolerate their nuances. So these are some questions which you have to ask yourself before you start thinking about pediatrics as a residency opportunity. So the first and foremost pro of pediatrics is that it is a clinical subject. It is a core clinical subject. Okay, so for people who have this dilemma between preclinical and paraclinical and clinical subjects, so if you have this knack of going towards clinical subject where you can be in the forefront of things, you can dealing with patients, dealing with the patient relatives. So pediatrics is one of the most core clinical subjects. Okay, and one of the other advantages of pediatrics is that it is not monotonous, because you'll have different set of patients, from patients who are just 1 hour old to patients who are 17 to 18, 12 years old, 17-year-old, 18-year-old. So you have a wide spectrum of patients. Okay, and each different age group will have their own set of problems. So pediatrics residency and pediatrics practice as a whole does not get monotonous, because you'll have different set of patients, each with their own set of physiologies and each with their own set of problems as well. So it is something which does not get repetitive, which does not get boring, and you have different spectrum of patients and different set of problems to deal with. Okay, the third thing which I would like to say is that pediatrics as a subject offers you a lot of options, because there's a preventive as well as a curative aspect to it, and it's up to you to choose what kind of practice you want to do, right? Because you don't just deal with sick children. Pediatrics does not mean dealing with sick children alone. Okay, there's growth and development, there's nutrition, there's vaccination, and there's a whole lot of spectrum of pediatrics, not just sick and dying children. Okay, so when you enter residency, you will usually have 3-month rotatory postings. Some can be in NICU, some can be in PICU, some can be in SNCU. Okay, some can be in ward, some can be in OPD, some can be in well baby clinic as well. So you'll be exposed to different varieties of cases which you'll be facing in your day-to-day practice as well, and you can absorb that this is something which I'm up for and this is something which I'm not up for. Okay, and one more thing is that, coming back to the point, that it offers you a lot of options. By the options I mean is that you are at full liberty to draw the line. Beyond this I don't want to do, or beyond this I don't want to carry out. So that is a kind of options that pediatrics offers to you. Okay, and innocent patients, cute patients, your chambers will always be live and cheerful. So that's one of the small advantages of pediatrics. And one more thing which I'll come to is that post residency, when you pass out of pediatrics, it is one of the most dynamic branches which offers DM opportunities, fellowship opportunities, foreign fellowship opportunities, and you cannot name any other subject which offers so much option. Okay, so there is no other subject which offers such a wide spectrum of choices at the end of residency. Okay, you can do DM in almost up to 20 subjects, which includes adult subjects, pediatric subjects, genetics, medical oncology as well. Okay, so you can do fellowships, you can do MRCPCH, you can travel to other countries, be members of other societies. Okay, you can also set up your own private chambers, join corporate, or go to tier 2, tier 3 cities, set up your own practice. So this wide variety of choices is offered merely just by pediatrics, because this is a wide spectrum which you can shift to adult medicine as well. And personally, that's something which I have actually done. I've always wanted to be a cardiologist, so post my residency I've taken Neet SS as well as INSS, and I've joined cardiology right now. So that's the kind of dynamicity, and that's the kind of wide spectrum which pediatrics offers to you, and which is something which is not available in other subjects. So that is the beauty of pediatrics. You can not only that you have wide spectrum of patients, you also have a wide spectrum of choices after residency. Okay, so this is one of the biggest advantages of pediatrics. Another advantage is that if you want to set up private chambers, set up your own practice, the cost of setup is absolutely minimal, because it just takes a bench, a chair, a pad, a pen, a small chamber, few toys to start your practice. You don't need to have expensive gadgets, expensive instruments, expensive setup to start your practice and get things rolling. So the cost of setup is very, very low. And if you have the art of patience, and if you can observe children, if you can observe their complaints, if you can observe their nature, and be patient with them, so this is just the field for you. And so it offers a lot of advantages, lots of pros. So having a good work-life balance at the end of pediatrics totally depends on you, because you are at the helm of things, and you can decide that beyond this I will not curtail my the body doesn't allow me to work beyond this, and you can always choose that this is what I want to do and this is what I am choosing not to do. So with such opportunities, it's one of the most unique subjects, offering you so many options, giving you so many opportunities, in so many different avenues. So that will one of the big things about pediatrics. And also in tier 2, tier 3 cities as well as tier 1 cities for that matter, earning respectable amount will not be an issue. So if you're clinically sound, if you can deal with patients and their relatives properly, so earning a respectable amount will never be an issue wherever you go, in fact, for that matter. So this is about the pros of pediatrics. Let's just dive into the cons of pediatrics. And just like any other field having its own set of issues, pediatrics does also have its own set of problems. And one of the foremost things which I would like to say is that the residency part of pediatrics is hectic. Okay, there's no way of sugarcoating it, and there's no way of beating around the bush. It is hectic. Sometimes 24 hours, 36 hours, and sometimes even 42 hours, 48 hours. You'll be on your toes, managing sick children, really sick children. Okay, and that can be the frustrating part of pediatrics, because sometimes even in the best of centers, you might not be able to help the children even with the best of your abilities, and that is really disheartening, sometimes sad. Sometimes you have that emotional connect which you should not have with your parents, with your patients, but it's something which cannot be avoided. And that's the frustrating part, because you're trying to save the life of an innocent patient, but sometimes even at the best of centers you cannot do that, or even with the best of your abilities you cannot add quality to their lives as the way you would have wanted to. Okay, and the residency part is hectic. There's no sugarcoating it. It's a very hectic residency. And also one more thing is that this is one of the most emotionally charged aspects of society, because children for their parents mean the world to them, right? So the emotions are always high, and since the emotions are always charged up, things can somehow and sometimes it can get out of hand. So even in your chambers, even dealing with parents outside your SNCOs and NICOs and PICOs can be a bit of a task, and you might have to deal with such situations very tactfully. And also people who want to enjoy the perks of being in a clinical field, the other end of the spectrum is that sometimes you might be pestered with a lot of anxious parents, calling you up at 2 a.m. at night, 3 a.m. at night, with silly issues and silly doubts and silly problems. So that is something we don't want. We want healthy interaction in broad daylight. But sometimes, you deal with over anxious parents, and over cautious mothers sometimes, and over cautious fathers, who will keep calling you at weird hours of the day, for their doubts and queries. So which is something we don't really like. So that's also dealing with really sick children can really be frustrating at times, because trying to get an IV access can sometimes take 45 to 50 minutes, and even with the most experienced hands, it is sometimes not possible. Okay, so that can be the frustrating part of pediatrics, because that is true for every field, but for most of pediatrics, it needs a special set of skill, to develop that knack to get the tough IV access as quickly as possible. So that is one part. Also, another part of pediatrics is that it needs real hard work, real dedication, and that experience does not come overnight, because when you enter your different postings in first year or in the middle of second year, you just cannot tell which baby is behaving normally, which baby is really sick, and your consultants can. So you might be wondering that ma'am or sir is able to tell that this baby is sick, but I cannot. How is it possible? Because they've had years and years of training. Their eyes are trained to look for the subtle cues of what is really sick and what is towards the normal side, and that for some people it takes a lot of time to develop. I being one of them. So to be able to tell a sick child from a normal child, this itself needs years of training. So that will not develop overnight. That will take time, and pediatrics it demands a lot of patience from you. So if you think that you have that patience of dealing with children, dealing with babies, dealing with their parents, dealing in that situation. So if you think that you can take up this challenge, then this field is perfectly made for you, tailor-made for you. And if you think that this is something you will not thrive in, so you can think again, think of other fields, weigh the pros and cons of other fields, because once you enter this field, there's a lot of beauty, but the struggle is also there. That is true for all the fields. So I hope this was helpful. So just a small compilation, just a small video, just a small compilation of the pros and cons. A lot of my personal opinions I've also shared. So if you want to just reconnect, you can just contact me anytime. So